I think the most important thing is we just need more options. You know, like there are lots of great medicines, there's lots of great practices and techniques, and that's not just Western medicine, that's Eastern and alternative. There's lots of things that work for lots of different people, but we need more options. And one of those needs to be cannabinoids tailored to individuals' endocannabinoid systems. That's a pretty big one.
I think, you know, we have a lot of conventional medications, and I'm sure it's the same for Jamie. I have a lot of patients coming in with massive polypharmacy, you know, taking maybe 15 or 20 medications every day, and not alleviating their pain or their symptoms.
No.
I think one of the hurdles at the moment is that cannabis medicines in Australia, at least, aren't allowed to be a first-line treatment. So you have to have tried one or several other conventional medications before you can access medicinal cannabis. Doesn't make sense from a harm basis, because cannabis medicines are so extremely safe. We know that, the studies have been done, the jury's in. Cannabis is extremely safe. So to trial that on a patient as a first-line treatment, there's no risk. There's no large risk. There's probably more risk of adverse effects from the majority of conventional medications. And probably Jamie would agree that often you can lower or remove conventional medications once you introduce cannabis. So it makes sense that it should be able to be used as a first-line treatment as well. If it doesn't work, well then let's try some opiates, then let's try some other medications. But it should be allowed to be first-line, I believe.
Yeah, I do too. And I think, again, going back to prohibition, you know, when things are banned, we can't study them, we can't look at it, we can't really assess its benefits. And you know, the endocannabinoid system, it's, you know, we've talked about this before, it's not strange science, it's an integral part of the human body, and nature gave us compounds that are extremely effective in manipulating it, and it was an error to not use it in medicine.
Yeah, to remove that from our pharmacopoeia was
it was
wrong.
an error.
You know, we've had, up until the 1940s in Australia, we could access cannabis medicines from the pharmacy. We can access them from the pharmacy again, and so we're back to where we started from, I suppose, and we should be moving forward from this point.
Yeah, and I think you know, humans, society, we've made lots of mistakes. You know, women couldn't vote. You know, gay people couldn't get married. Smoking was prescribed to children. You know, like these are errors that we've moved beyond. So this is just another one. It doesn't need to be a big deal.
And the endocannabinoid system, it is an integral system, and the fact that a molecule from the cannabis plant is exactly the same shape, not roughly, but pretty much exactly the same shape as our natural cannabinoids which we secrete in our body, that's how the medicine works. It's the same as the opiate system. The molecules are the right shape to fit the receptors, therefore there's a purpose.
There's a purpose.
And there's more than one purpose to the endocannabinoid system. It's a multi-layered, multifaceted system.
Yeah, but it does require a different way of thinking, doesn't it? You know, even how these medicines have their effect, it's not like a standard painkiller. Paracetamol, take that, pain goes away, wears off, take it again. We're using them in a different methodology, which requires a different way of thinking, which isn't being taught in medical schools and to doctors. And I think that scares people, but we just need to teach people and help it come into practice more, I suppose.
I think the main thing you're talking about there is the fact that, you have pain, you take some opiates. That's how our current conventional system works. Whereas working from the endocannabinoid system up, you support the endocannabinoid system, and you prophylactically avoid the pain or the symptom, rather than symptomatically taking a pill. Yeah, that's the major difference.
That's it. It's not treating symptoms, it's treating something that's dysregulated in the body.
Which results in relief of symptoms.
Which results in relief of symptoms. But that's not, that kind of much more holistic and global way of approaching medicine is not how a lot of doctors are taught how to work, you know.
So I think that